Hey, hello guys, I'm happy for you. My camera is just poor, but just understand me for this. But I'm working on how to improve it. The last video I did was on classification of family planning. Then I talk on IUCD. So today I'm going to speak on depo provela. Depo. What is depo? It's just a brand name of injectable contraceptive devices that prevent pregnancy for 3 months. How does depo work? Depo can work in three different ways. The first way, it can work by thinning the lining of the uterus or the endometrium. Hence, by doing this, it does not allow for implantation to take place. Another way on how depo works, it works by thickening the cervical mucus. Hence, by doing this, it prevents sperms from reaching the fertilized egg. The third way on how it works, it works by stopping ovulation. Hence, by stopping ovulation, there is no egg to be fertilized. Those are three mechanisms of action on how depo works. Let us talk on the effectiveness of depo. The effectiveness of depo is 100% effective when used in the right way and effectively and consistency. It is just 100 in preventing of pregnancy. So what are the advantages of depo? The main advantages of depo is that there is no time you can remember of taking pills. So once injectable, just wait for the 3 months, then you get another dose. That is the big advantage, is to prevent pregnancy for 3 months, just a long-term prevention of pregnancy. What are the disadvantages? Disadvantages, or sometimes you can take is at the some limitation of depo. The disadvantages of depo is that it does not prevent STIs. Another disadvantage of depo is that fertility does not return back immediately after after completion of depo. So you are at risk of infertility when you use depo for almost 2 years. So another disadvantages is that it can cause irregular bleeding. Another disadvantage is that it can cause weight gain to some people, and sometimes it can cause nausea and dizziness. Those are some of the disadvantages of depo. Let us see on the contraindications of depo. So some of the contraindication of depo is that it is being contraindicated to patients or people who have breast cancers. It also contraindicated to people who have liver diseases. It also contraindicated to people who have blood disorders, because when you have blood disorders, it can cause severe bleeding. Then it end up letting some complication into your body. So, and a good example is that if you use depo more than 2 years, you will end up developing condition like medical condition like osteoporosis. What is osteoporosis? Osteoporosis is just loss of bone mineral density to women, maybe menopause, to women, and to those young gender who have who are underweight. Another way, it can cause severe bleeding, hence ending into some complication like anemia sometimes, or any other medical condition. And a good example is that depo-provela, that ampule contain 150 milligrams compared to Jardel, which contains 75 mgs. 75 mgs can take you up to 5 years or sometimes 3 years. But prevent prevent pregnancy, but depo can take you up to 3 months. So for example, a good example that I can give you, there are two people here. One is using depo, another one is using jadel. So this one using depo has used the depo for within 1 year, has used the depo for almost 4 times. So calculate 4 times 150, you will end up getting about 450. And this one who has been and the other one who has used Jadel that contains 75 milligrams has it has lasted for 5 years. So do you think that if you compare these two people, when in future they will want to get babies, they want to conceive, the fertility will be different? The one who has been using the depo for almost 2 years will end up getting maybe into infertility, or sometimes you cannot get pregnancy easily. It can end up for several months, or sometimes can end up into a year. So before choosing any family planning method, you need to get some information on each and every method. So thank you guys, thank you for your time, thank you for watching me. I'm happy guys, I'm very happy. My camera is not good, but I'm going to work on it and just improve on it. Thank you. Welcome to Nasmarwa Studio or Nasmarwa Station. Just like, share, and subscribe. I appreciate you all. Thank you so much.